Hello, my name's Bill McGuiness, and I've been in wound management both as a clinician and a researcher for over 20 years. Today, what I'd like to do is to talk to you about electrical stimulation in wound healing. This is not a new concept, it's been around for a number of years. But more recent developments in the technology to deliver the care and more recent research tends to suggest that it should be part of our portfolio of wound management strategies. Just a quick declaration of interest. Whatever you see here is not influenced by manufacturers or industry. It is purely from my own research of the literature and clinical experience. Now, we know from research, and have done for a number of years, that the skin is actually composed of several layers. That's an important function because it means that we can apply friction and pressure and those sorts of things to the external layers without damaging lower structures. And to achieve this, the cells are actually arranged into tissues or tissue planes. When we damage these tissues, we know that it sets up a cascade of different physiological processes that start the healing of that area of damage. That process is heavily influenced by the function of different cells, beginning with activities of such as mast cells and the inflammatory process, and ending with things like the laying down of collagen with fibroblasts or new blood vessels with endothelial cells, and then the final cover of epithelium. That whole process is controlled by messenger molecules or proteins that attach to those cells and ensure they carry out their functions. For example, a macrophage becomes mature when it's attached by one of these particular proteins. Growth factors, cytokines, endocrine hormones, and proteinases are all examples of these proteins that stimulate cellular activity. So that's contemporary understanding of wound healing. The question we have to ask ourselves is, well, where does electricity fit within this process? For many years, we've known that there's a group of cells that perform their function by changing the electrical potential of that cell across its membrane. It's usually called repolarization and depolarization. And when we talk about it, people often refer to neural muscles, muscle cells, endocrine cells, and those of the cardiac conductive system. And that whole grouping is tended to be called excitable cells. More recently, however, we now know that ability to transfer ions across a membrane and change electrical potential is evident in other cells. And this study that was conducted in 2015 was able to demonstrate that even immunocytes are able to do this depolarization and repolarization. So what would normally be classified as a non-excitable cell is still able to carry out similar functions to that of excitable cells. How is this achieved? Well, we know that by simply allowing ions to pass through the cell membrane from the interstitial space to the intracellular space and vice versa, we start to set up a charge or electrical charge either side of that cell membrane, depending on how many positives or negatives we have on each side. So if we look at that cell membrane for a resting cell, we know that principally on the outside there is sodium and chloride, and on the inside there's potassium and phosphate. That results in, of course, a charge of negative inside, positive on the outside, and its resting membrane potential, as it's called, is measured for undamaged skin cells at 10 to 16 millivolts of electricity. So that's at rest. So how do they change the electrical potential? Well, it occurs through something called ion channels, channels in which these ions can pass through and change the electrical potentials on either side of the membrane. No, it's not this type of ion, and it's not this type of ion. What we're talking about are small channels within the cell membrane itself. But there are several of them, okay? But what they do is they enable these ions, as we said, to pass from one side of the membrane to the other. And when you do that, you then start to change the actual charge and electrical potential across that membrane. When you depolarize the electrical potential in skin cell or damaged skin cells, the electricity or that activity, if you like, increases to 100 to 150 millivolts. much higher than the healthy skin that we talked about earlier. So if that's occurring when we damage skin, is it playing a part in actually healing the wound itself? Now, these channels come in lots of different forms, okay? There's the first one is really a passive form, where you're constantly leaking these ions between the membranes through that ion channel. Then there's a group of channels that only open when certain situations occur. So chemical gated channels, as they're called, only occur when a certain chemical reaction occurs. Voltage gated channels occur when the voltage changes and it opens up certain channels to enable the exchange of ions. And then there's mechanical, so when you actually put mechanical stresses on the actual gated channel, it enables ions to leak through it. And then finally, there's some active gates, or pumps as they're called, principally sodium and potassium, that use energy from the cells, ATP, to actively open and close and transfer ions between those two spaces that we talked about. So you can see it's leaking. There's things that occur when there's certain stimulus occurs, and then there's the active pump where they use ATP or energy to open and close. So quite a complex group of functions, but it's that mechanical function that you would imagine would occur when you damage the skin. You actually put pressures on these ion, you change the mechanical forces on these ion channels, enabling things to transfer. Now, that transfer of electricity, we know, leads to lots of bioelectrical signaling. I mean, an ECG or an EEG is a classic example of how we can develop technology to measure that electrical signaling through those cells. In damaged skin, as I said, by stretching those mechanical gated ion channels, we start to see the electrical stimulation occur. It changes the electrical threshold of the immune cells. Like we said, they are able to repolarize the same as excitable cells. That change in threshold then stimulates the production of growth factors and cytokines, which then in turn activate those leukocytes, fibroblasts, and endothelial cells that we know are part of the healing cycle. So that ion exchange, that change in the electrical threshold, stimulates the growth factors, which then stimulate the cellular activity. Here's an example of a paper that says that not only do you get that change in the change in charge, if you like, when you damage the skin, but there seems to be some indication that the ability to pass electricity through the skin helps with the arrangement of tissues within the skin itself. So it's not only starting the healing cycle by stimulating the cytokines and cellular activities, there is some notion that the electrical charge encourages cells or provides a pathway, if you like, for cells to lay themselves down in a way that's the same as the tissues of the skin. So here's an example of a cross-section of skin. And when you apply electrical charges across that, it seems to be that they follow specific pathways. So within the same tissue, they're called what's known as loose junctions or loose connections. So the electrical stimulus quite easily passes across those tissue layers. However, if the electrical stimulation then tries to pass between tissues, it tends not to be as active. And it's believed it's because the actual junction between the two tissue layers is a firm or a hard junction. So not only is this electrical stimulation stimulating cytokines and cellular activities to heal the wound, it's probably providing a pathway for the new cells to follow. So you get the same layering of tissue within the skin. So given that the body already produces electrical stimulation to heal itself, can we enhance the effect by using electrical stimulation technologies? Just because we can make it stronger doesn't mean to say it's going to make the effect of wound healing any better. Now, there's a number of machines that generate electrical wound healing areas, but they tend to be what's called a pulse current. So if we look at normal skin or wounds, they tend to have a continuous direct current of electrical charge pass across them. However, the machines that we use for wound healing tend to have a pulsed current, and that's really to prevent damage to the skin. A continuous direct current may well overheat specific areas of skin and burn it, where a pulsed current, both a monophasic and a biphasic pulsed current, okay, has the ability to lessen the damage but still provide electrical stimulation. The monophasic, as it suggests, is one waveform. Biphasic means it goes one way and then goes back the other way. So you start to see two waveforms or more than that develop. And the machines we have the ability to alter both the voltage, okay, so the size of wave and the current, the energy within the waveform itself. So these can be altered so we can change the amount of electricity or electrical stimulation that's being applied to the wound. This particular research you can see done in 2018 or published in 2018 quite clearly showed that when you apply pulsed electrical stimulation to wounds, you get a similar effect as you do with a constant or direct current. So what we're saying is the pulsed is a similar effect with the reduction of skin damage from that burning or excessive energy that I talked about earlier. Wound healing currents then are pulsed, like we said, but they can be low or high voltage options, and it really depends on the machine that you use. We know that the use of electrical stimulation by technology is well entrenched in other areas. For example, in the area of orthopedics, pulsed electromagnetic fields are used to encourage recalcitrant fractures to heal. We know that transcutaneous electrical nerve stimulation, or TENS, can be used to depolarize sensory nerves so that we can control pain for people with retractive pain that either don't want narcotic or pharmacological intervention or are resistant to any pharmacological intervention. And then more recently, we're seeing research now talking about electroporation, where they use electrical stimulation to increase the permeability of the cell so the medications can enter the cell. Cancer treatments are starting to do that. There's also some research in the literature about how we can use it just for topical applications of certain creams to ensure a greater cellular penetration of those products. So health is using electricity. Wound management is starting to look at it much more seriously. Typically, the machines we're going to use will have some sort of power source, and then they have the ability to conduct that power source along some leads and through some conducting pads, or electrodes as they tend to be called. Not dissimilar to the electrodes that used to measure electrical impulses with things like ECG or EEGs. In the past, these machines tend to be quite clunky and they require often close monitoring of the patient or having the patient hospitalised to receive the treatment, or at least to come to a specialist centre. However, more recently now, we're seeing much more options in the single-use variety for electrical stimulation. This one by the Celahil, for example, provides a small pack of 6 by 48-hour devices, the preps for alcohol swabs, and then the 3 packs of electrodes and some instructions of how to use it, and they can be disposed of. So what this enables us to do, of course, is to now use these within a home environment, and the application is so easy that we know that we can trust patients to be changing them for themselves. The need to come to specialist centres aren't there anymore, but you can still provide the electrical stimulation that we know seems to be of some advantage. These devices, as I said, enable us to vary current and time of exposure, so the amount of energy we're putting through plus the time that we provide that energy. And we know that from the research to date, and it is mixed, the research, that ranges between 250 to 500 microcoulombs per second tend to be the range that go ahead and encourage wound healing. Are there any reported adverse reactions to this? Well, there seem to be very few. There's not much at all documented. Most of the time, it's about a skin reaction to the electrode, and it's probably due to the adhesive on the electrode, such as the acrylic adhesives, than anything else. Yes, if you're to increase the frequency or the energy, I should say, the temperature to such a high level, you may well burn the skin. But these machines are scaled down to such a step that that wouldn't enable you to do that. So it's a fairly safe device to be using. So we've said that electrical stimulation in the normal physiology is present, and we think it stimulates cytokines, and we think it helps tissues arrange themselves. We've also said that there's a group of technologies available on the market now that can deliver pulse currents in a very efficient, home-based, patient-driven options. But does it help, is the question. What's the evidence that says it's part of something we should be considering for wound healing? Well, I'm going to point you to 3 comprehensive reviews on the literature to date. And I find that these actually have provided a very nice potted history, if you like, or potted examples of the research that's been done. So this is where I'll be drawing most of the remainder of the presentation from, these reviews, but also some additional articles. So this one here, first one you can see here, was done in 2013, and I started to look at what was the evidence to date for electrical stimulation to accelerate wound healing. In 2014, this particular review built on the 2013 review and included additional, more recent research to give examples of how it may or may not be assisting. And then this final review here in 2021 has provided a very, very nice potted history of the research to date, but more importantly, has provided a very easy to understand explanation of how the electrical stimulation may be helping at a physiological process. So take your time to have a look at those 3 reviews because they actually do provide a lot of additional information that you probably get beyond my presentation. So let's look at the healing cycle now and see what some of the evidence suggests for each of them. The first is this notion of cellular migration. We know that the ability to migrate things such as the professional phagocytes to the damaged area, or the ability for fibroblasts to migrate through the collagen, or the ability for epithelial cells to migrate over the collagen matrix, is essential. So does electrical stimulation help? Well, there seems to be there is evidence that says that cells migrate towards an electrical field with an opposite polarity. So things like macrophages, for example, tend to be attracted to a positive or an anode end of the pole. Fibroblasts, on the other hand, tend to move towards the cathode, or what's traditionally negative, not exactly, but we'll think about it for this presentation. So if you were wanting to say, okay, let's try and stimulate particular cell types, such as can we get some immune response to an obviously badly infected wound, it may well be that we select machines that will attract more of the macrophages. Equally, if we've got a slow to heal wound, it might be that we're starting to attract more fibroblasts by using this electrical stimulation and changing the polarity. Things like neutrophils, we know, tend to be non-binary, and they will go to both positive and negative poles. So there seems to be some evidence that by using electrical stimulation, we can start to be self-selective in terms of activities within the actual wound itself. Here's a human study looking at that same sort of thing, and this is where the healthy volunteers had actual wounds created for them, and then they had electrical stimulation applied, so that the examination of the wounds was 6 hours after the treatment, and then they looked at the neutrophil count, and they quite clearly demonstrated the area that had electrical stimulation, the neutrophil count was 24% higher than the area that hadn't had the electrical stimulation. So the in vitro material suggests that cells are attracted to different poles. This human study further shows that by using electrical stimulation, we're at least attracting the professional phagocytes, or white cells, into the area, which we know are essential for removing the dead necrotic tissue and providing protection. What about tissue perfusion? Well, there's a number of effects on tissue perfusion. This study in 1998, so as I said, this has been around for a long time, this type of research, was a randomized controlled trial of 19 diabetic patients, 11 with impaired peripheral perfusion, and they were given 4 by 60-minute treatments of electrical stimulation. They measured perfusion by using continuously for 1 hour, and they used both the transcutaneous pressure oxygen monitor and a laser Doppler. So you're not only getting the amount of oxygen delivered, you're also getting any effects on vasculature using a laser Doppler. So two pretty robust measurements. Participants with the peripheral vascular disease showed a significant rise in tissue perfusion, where patients who didn't have PVD showed no difference. So what it's suggesting is this electrical stimulation is actually increasing perfusion of the area. They were of the opinion, however, though, that effect was transitory. And we see this a bit with hyperbaric patients. You put them in a hyperbaric chamber, an ischemic limb becomes a lovely pink colour, and within sort of 30 minutes or so of leaving the chamber, we start to see that mottled, impaired colour returning. So it seems like electrical stimulation may well be improving perfusion of a wound. Here's another perfusion study done in 2002, where they took a case series of 6 patients with critical peripheral vascular disease. So critical peripheral vascular disease are people who are probably only next option of treatment is going to be amputation. They used high voltage pulse currents and measured maximum mean T-comps, and they give treatments for 40 days. This is a fairly extensive amount of treatment. They showed that oxygen tension exceeded 27 millimeters of mercury. So it's quite an increase on oxygen tension for people with critical peripheral vascular disease. And of those, 4 patients went on to heal their wounds. So these are patients that would normally have had an amputation, went on to heal their wounds. 2 patients still had to have amputation. The increase in the oxygen perfusion wasn't enough to save their limbs. This study by Clover in 2003 is another randomized controlled trial of 36 patients with peripheral vascular disease using 6 weeks of electrical stimulation. Capillary microscopy was measured before treatment, 3 and 6 weeks during treatment, and 4 weeks after treatment. So there's the ability to actually have a look and see what the capillary beds are doing as a result of the electrical stimulation. That study showed there was an increase in capillary density of 25%. So it's a quarter again of capillary perfusion than what was there prior to the treatment. And that increase in capillary density led to an oxygen tension increase of 1.24-fold. So there's 3 studies that tend to indicate that by using electrical stimulation, we're actually encouraging perfusion of the actual tissue site itself. What about their ability to proliferate and remodel areas? We've already said that electrical stimulation seems to provide pathways for tissues to follow, so you get a differentiation of tissue planes. Well, this study conducted in 2011 was a double-blinded prospective study, so people didn't know if they were getting electrical stimulation or not. 20 participants had biopsies taken from each arm, and then they were given electrical stimulation to one arm only. So in effect, they were becoming their own controls by having one arm used and the other arm not getting the electrical stimulation. Secondary biopsy was taken for histology at the completion of the 14-day trial. They were able to quite clearly demonstrate that where they used electrical stimulation, they had a 42% increase in the expression of VEGF, vascular endothelial growth factors, so one of those growth factors we talked about earlier. There's an expression of epithelial cells of 6%, and there was a reduction in inflammation, enhanced angiogenesis, and advanced remodeling of the actual tissue in the biopsies that were taken. So this is some evidence that suggests that by using electrical stimulation, we at least start to encourage the proliferation of cells and then the remodeling of cells on those tissue planes. This study in 2013 examined the effects of human fibroblasts, but in an in vitro climate, so a test tube or lab-based study. They used electrical stimulation, you can see there, 50 to 200 millivolts for 2, 4, and 6 hours. This study demonstrated a significant increase in fibroblast growth factors, so FGF1 and 2. Fibroblast migration was faster following electrical stimulation. Remember, we talked about them moving to those different poles. The fibroblasts had a higher contractile behavior. So when we know that fibroblasts lay down collagen, and as they do that, They pull themselves through the collagen, striping their cytoplasm, which leads to the term of myofibroblasts, but it's that pulling them through the actual tissue that tends to then contract the wound. So they showed an increase in that contractile behaviour. There was an increased transition from fibroblasts to myofibroblasts, which tells you they're more active because they're stretching themselves and becoming myofibrotic. And there's modulations of fibroblasts continued long after the electrical stimulation had stopped. So it's not just a one-off effect, it tends to have quite a lengthy tail, if you like, to the treatment. This study in 2015 examined the effects of electrical stimulation on keratinocytes. And they were able to show it was an in vitro study, so again, lab-based, significant increase in keratinocyte production, so 38% increase, and an increase in epithelial thickness of 18%. So it starts to lend support to that notion of the stimulation of cytokines to stimulate the proliferation of cells, and then the use of electrical pathways to encourage the laying down along particular tissue planes, such as the epithelium. What about wound bacteria? Well, again, there seems to be some indication that electrical stimulation can be used to reduce bacterial burden. Here's a study done back in 74. So as I said, it's been around for a long time, 74, where they used rabbit ear models with Pseudomonas as the infective bacteria. They treated them with low intensity direct currents. This is one of the earlier direct currents. This is the pulsed current that we've talked about from today, of 0.2 to 2 microamps. And they were able to demonstrate there was a clear bacteriostatic effect. So a reduction in the bacterial load, if you like, with some cell death, or at least a propensity to stop multiplication of the bacteria. This study in 89, another in vitro lab-based study, used monophasic high voltage pulsed electrical stimulation, and their organisms were Staph aureus, E. coli, and Pseudomonas. So the three that we commonly see as a wound infective organism. They showed that there was a linear relationship between voltage and exposure on bacteria counts. In other words, when you started to increase voltage, you started to see a decreased count of bacteria. And more than 250 volts for at least 2 hours resulted in a degree of inhibition for all 3 bacteria, probably millivolts, I suspect. So there's examples here that by using electrical stimulation, we actually start to reduce bacterial multiplication, at least. This study in 2007 used 3 gram-negative and gram-positive bacteria. We know the gram-negative are the ones that tend to create the most trouble for us in terms of trying to eliminate wound infections. So things like E. coli, Pseudomonas, and Klebsiella are examples. The gram-positive they used were Staph aureus, Staphyloderma epidermal, and E. coli within the facet. Yeah, that level. Sorry, a little bit brain dead. Okay. They used positive and negative monophasic low voltage pulse currents. They showed a significant reduction in all organisms, okay, with the highest reduction when they were using the positive polarity. Remember, we talked about cells being attracted to certain poles. So here's another example of by using different poles, we're able to target the cells, if you like, that we're trying to work on. They also showed an increased blood flow, protein donation, and a stimulation of cellular defenses. So not only is it destroying the bacteria, that's that protein damage we talked about there, they're also increasing blood flow, which in turn is increasing the amount of professional phagocytes that can be brought to the area to then start to destroy the bacteria. So it seems like electrical stimulation has an effect on bacteria as well. So what does this have on all chronic wounds? We've said that it's a stimulant for wound, for cytokine production, it's a stimulant for cellular proliferation, it's a stimulant for mobility of cells, and it tends to work against bacterial colonies by either enhancing leukocyte activity or by reducing the effect of bacterial multiplication. So all of those things you would think should help, because they're all the problems that we face within a chronic wound. This study in 2021 looked at, this review, I should say, in 2021, looked at 12 randomized controlled trials to actually start to say, is there an effect on slow to heal wounds? So those trials were 1988 to 2018, which when you combine them together, provided 532 participants, some of them diabetic. They used percentage of area reduction as the endpoint, if you like, or the measurement, the PAR, and they were able to show that there was varying results throughout those studies, but all studies reported accelerated healing when they used electrical stimulation. So whilst the effect is not constant, there is at least a trend, an indicative trend that says if you use it, you tend to get a better heal rate. There's a number of limitations, of course, on the studies that we've reviewed to date. There are multiple variables within the patient cohorts, things like age, comorbidity, ethnicity, geographic location are all areas that, of course, are confounding some of the findings. There's also variable electrical stimulation use. We've talked about most of it actually being pulsed, or all of it being pulsed, but the changes in polarity, the duration of time used, and the method that was used, be it placing a direct current through the wound itself or an indirect current by placing electrodes in different locations and having the electrical stimulation pass through adjacent tissues plus the wound tissue. So questions still exist around what is the best dose, if you like, for electrical stimulation, but the trends indicate that by using any electrical stimulation, pulsed electrical stimulation, through the technologies available, we probably should see some benefits, particularly to those slow to heal or chronic wounds. So in summary, electrical stimulation enhances the normal electrical gradient established by damaged skin. Electrical stimulation has been shown to accelerate wound healing by reducing bacterial burden, improving circulation, and increasing cellular proliferation and mobility. Adverse reactions to electrical stimulation are minimal, making it quite a safe treatment, and the newer technologies available now make it a very usable treatment in the community and patient-driven care rather than clinician-driven care. However, further research is needed to establish treatment regimes and therapeutic doses for wound healing so that we can be confident that when we use particular techniques and particular doses, particular client cohorts, we're going to get a fairly consistent, robust effect. I would like to say thank you for your time. I hope this has been of some information, and please go back and have a look at some of those reviews I've mentioned or some of the other literature available, and take some time to look at these newer devices now that actually deliver the care in a very, very, very easy and very mobile fashion. Thank you very much.